welcome everyone. While we are waiting for everybody to settle, I've got a little poll. So the first question that is this your first educating out racism? The second question is, are you white? Kept it simple rather than messing with the BAME, Black and Asian acronym. Are you LGBTIQ plus? And are you in the UK? So if you could take a couple of minutes, we've already got 31 people. Some people are keen. Welcome, welcome, welcome. So there is a poll that I'm encouraging you to complete. So is this your first educating out racism, or did you come to the last one in September? And I always like to, it's really bizarre because we're in virtual space and we can't see who we're talking to. So I think it's really nice to be able to gauge a little bit about who people are. So thank you very much for taking the time to respond. And we're expecting over 100 people, so it's only 14:01. So we'll give you a couple of minutes. So I can see that 18%, 20% on you. Sorry, 80% on you, but 20% came to the last one. So welcome back. Interesting to look at race and sexual orientation. I didn't include disability. And most of the people are watching in the UK. So the couple of people who said that they are not in the UK, do you want to use the chat and let us know where you're watching from? That'd be really lovely to see where you're watching us from. And I'll introduce the first speaker in 1 minute. I'm going to end the poll and share the results now. So 77% are new to the Educating Out Racism, so welcome. And we've got 81% who identify as white, 32% who identify as LGBTIQ, and 94% in the UK. So welcome everyone, and thank you very, very much for joining us. I would like to welcome the very, very first speaker, Cynthia Davis, to introduce the conference and tell us why it was important for your organization to support this event.
Hi, Lila, and thank you so much for inviting us to be here. So I'm Cynthia Davis, and I'm the Chief Exec of BAME Recruitment and also Diversifying. You know, for us, this is a very important topic. It's what we live for as an organization. It's in our kind of DNA to really go out and work and talk to organizations who are looking to eradicate some of the deep ingrained systematic and racism that still exists. So today's topic is very important to us, and we're delighted to be supporting this event. You know, over the past 6 years as an organization, this is what we've been working with organizations to try and address through a number of different ways, whether that's bringing in talent from all walks of life to make sure that everyone has equal access to opportunities, but to also remove some of those barriers that still exist in our kind of everyday kind of, you know, careers or work environments. And I think without having some of these kind of brave conversations, we never really address this. So events like today are really, really important to shine a light on that, but to also educate people. And I think the more we talk about it and the more we educate ourselves, that's the only way that we will move forward as individuals, as a society. But, you know, we all want to live in a world where we can just be our true, authentic selves. That will never happen unless we're allowed to do that. So events like this are so important. That's why we're absolutely delighted to be here to really start those conversations and get a little bit uncomfortable at times, but that's the only way that we grow and the only way we move forward.
Thank you so much. And we'll hear more about your organization in the first session with Luke. So thank you so very, very, very much. I'd like now to just share the screen for a second and just take you through the program. So you should all have received it. So Professor Russi Jaspal is our keynote. and we'll be looking at the research findings on the impact of COVID-19 on well-being among minority groups in the UK. And we've got Vanda to support the panel looking at supporting employment with Luke, Elizabeth and Maria. Then we've got a little bit of a performance from Andrea Leanne, and you have a bit of a comfort break. I don't know whether you have seen, but we've got a couple of Slido opens which were emailed to you, where we're asking you to provide us with an example of belonging activities in your workplace. And we're taking workplace in the broadest sense of the term. So it could be, if you're working in education, it could be how you foster a place of belonging for your learners, or it could also be within your employment, and also asking you, what does belonging mean to you? But in the context of work. So that's that. And then we go straight into the second session with Dr. Nafisa Graham-Brown, Amy, Veronica, Alison, and Dr. Patrick Vernon. And Luke will be providing us with a closing remark. Now at 4 o'clock, you have a choice of 6 different workshops. All of them are 30 minutes, so one at 4, one at 4:30. So if you haven't had a chance to have a look at the program, please do. There's some fantastic workshops. The one from BAME Recruitment is focusing on employers in the first half and job seekers in the second half. Elizabeth will be showcasing the benefits of coaching and mentoring. If you're interested in mindfulness, then join Alison. If you're interested in the Haringey Vanguard, join Veronica. Or if you want to have a closer look at the London Metropolitan Archive, that's there too. Or if you want to find out more about stress management, then please do. So without further ado, I would like to welcome, Vanda, would you like to introduce yourself, please?
Hi, lovely to be here. My name's Dr. Vanda Popolska and I'm Executive Director of the Equality Trust. Thank you.
Thank you very much. And Rusi?
Hello, I'm Rusi Jaspal and I'm Professor of Psychology at Nottingham-Trent University.
Thank you very much. So without further ado, Rusi, the floor is yours.
Thank you very much. I'll just share my screen and I'll make a start.
So if you have any comments, you can use the chat feature, or if you have any specific questions, if you could please use the Q&A, that'd be really, really useful.
Thank you, Lila. Well, first of all, thank you very much for inviting me. It's always a tremendous pleasure to contribute to events that tap into such important issues like the one that we're talking about today. My presentation is about the impact of COVID-19 on well-being among minority groups in the UK. And I want to talk about a variety of minority groups. There will be a focus on ethnic minority groups, but actually I want to broaden the discussion somewhat to include other minority groups, and indeed how these groups might intersect with one another, how minority identities might intersect with one another to produce particular outcomes during this pandemic. I'm going to draw on examples from a variety of studies. I've decided not to present an awful lot of statistics because I'd much rather focus on the qualitative material, the interpretations, but I'm of course very happy to share with interested others the research papers upon which this presentation is based. To begin with, I'd like to just say a few words about COVID-19 and the pandemic and where we are in the pandemic. Again, I don't think it's really necessary to present statistics because we are on a daily basis bombarded with lots of information that's constantly changing. But just a few points that I think are worth making. COVID-19 is, of course, a global pandemic. There are about 4 million cases. There have been about 4 million cases in the UK. The death toll associated with this disease is extremely high in the UK. And this is, of course, changing on a daily basis with over 110,000 deaths in the UK that can be attributed to COVID-19. But on a slightly more positive note, there have been almost 10.5 million people who've received the first dose of the vaccine. And that certainly gives us a great deal of optimism for the future. What we've seen throughout the pandemic is that some groups appear to be more affected in a variety of ways than others, and that's partly what I want to talk about this afternoon. The pandemic itself has also been characterized by uncertainty, by mistrust, by rapid change, by a proliferation of different representations and pieces of information, some of which seem to contradict one another, leading to further uncertainty. As we know, various measures have been introduced to control the pandemic, most notably our social distancing policy. And the effects of both the pandemic and the measures designed to curb it have been multifarious, resulting in not only outcomes for our physical health, but particular outcomes for our mental health and well-being. And it will be really on the latter point that I want to focus. First of all, what do I mean by minority groups? Well, what I really want to advocate is a broad understanding of minority groups. When we talk about minorities, we can talk about minorities in terms of their numbers. Are the numbers smaller compared to another group? We can also talk about minorities in terms of the social status that they may have, or the stigma, rather, that can sometimes be appended to these minority groups. We can also think about the amount of institutional support or control or power that groups have. And often those groups that are defined as minority groups have lower levels of institutional support, control, and power. In my presentation, I'm going to be talking about groups that are often categorized as BAME, Black, Asian, and minority ethnic groups, and indeed I'll be challenging that construct a little bit. I'll be talking about people who face inequalities on the basis of income, health status, such as having poor mental health outcomes, and I'll be talking about sexual minorities. Finally, I'll talk very briefly about another context in which we've been doing research in the international sphere with some data from Lebanon. Well, we, at the beginning of the pandemic, did a study that tapped into a really significant issue at the time, and that was this phenomenon that came to be known as panic buying. We wanted to understand why people might be panic buying, why people may be taking that decision, and the factors that may surround this type of behavior that we knew was rather maladaptive because it resulted in sort of chaos up and down the country. There were quite vulnerable groups of people who were unable to do their shopping and so on and so forth. And it also instilled, I think, accentuated the fear that was already increasing within society. So we did a qualitative study in really at the very early stages of the pandemic and the outbreak rather in the UK. And I just want to share with you a couple of key observations from that interview study that consisted of interviews with 15 self-defined low-income people in South London. Now, there was a lot of journalism and media reporting about this phenomenon, and we wanted to sort of look under the bonnet a little bit more and understand what may be motivating people to engage in this behavior. What became quite clear to us was that the pandemic itself was very poorly understood, understandably so, because it was very new, it was very novel, and it was being explained in a variety of ways. But it was clearly very threatening for people because of that uncertainty. People talked about the pandemic as being really challenging for their sense of continuity. Will they be able to do the same things that they were doing previously as a result of this pandemic? Will they have the ability to look after people in their family and indeed themselves? And so we define this really, the pandemic, as posing a threat to people's sense of continuity and self-efficacy, you know, that sense of continuity over time and people's sense of power and control. Panic buying was defined by many people as a means of restoring that continuity by getting there first and buying things that might restore an element of normality to lives that were being changed as a result of the pandemic and indeed the measures to control it. It was also seen by many people as being a means of maintaining control when actually we appeared to be losing control. So I think rather than pathologizing panic buying, as was often the case in the press, and there was a great deal of stigma attributed to this type of behavior, we wanted to provide an alternative perspective as to why some people, in our case, people who are self-identified as having a low income, may be engaging in this type of behavior. We also later on did a large-scale survey study where we wanted to understand a little bit more in a larger sample of people, because that was a preliminary study, what the motivations for panic buying may well be. And what we found when we measured a number of inequalities was that those participants who were diagnosed with a mental health condition such as depression or anxiety reported higher levels of fear in relation to the pandemic, which in turn was associated with panic buying. So the higher one's level of fear, the more likely it was that one was to engage in this sort of behavior. We also looked at different religious groups because this was very novel at the time. We wanted to get a snapshot of how different groups may be responding to the pandemic. And we also found that those who self-identified as being Muslim were also more likely to be fearful of COVID. And I'll talk a little bit more about why minority groups may be expressing even higher levels of fear in response to the pandemic on my next slide. But again, as I've mentioned, fear was associated with panic buying. We also looked at another behavior that we knew at the time was going to be protective, and that was working from home. And of course, as many predicted, there were inequalities in terms of who was actually able to work from home. Income, of course, was a very key predictor, with those who were earning less being a lot less likely to actually work from home. But we also found on a psychological level that those people who reported having less social support, those people who reported being more marginalized, exhibited more fear, which was less likely, made them less likely to work from home. As you can see, we're building a picture here where we've got some preliminary evidence for some inequalities early on in the pandemic. So we wanted to take this forward to understand this a little bit more and to home in on particular groups and to get a sense of how inequalities may be affecting people during the pandemic. A few months later, we did another survey when social distancing was more established, when there was a little bit more information about the pandemic. We did a survey specifically in the borough of Wandsworth, which is where I'm based. And we wanted to examine socioeconomic and health inequalities on some of the things that we know were affecting people disproportionately during the pandemic: loneliness, social connectedness, and people's mental health. What we found was that those with long-term health conditions were more isolated. They reported feeling more lonely and more depressed during the pandemic. This, of course, was a snapshot in the middle of lockdown. Those who also reported receiving benefits were more isolated, tapping into providing a bit more evidence around the income inequalities. Again, more loneliness and more depression and anxiety in this case during the pandemic. Now, it's easy to see how during an unprecedented event like a pandemic, some of these existing inequalities can become accentuated, and their effect on mental health can also become accentuated. Moving on to the role of identity and discrimination, ethnicity in this pandemic, I want to present a bit of data that we collected specifically among BAME groups, the BAME community and BAME people. We wanted to look at the role of discrimination. Having established that some of the inequalities are being accentuated, we wanted to look at how discrimination, which we know is already present in our society, may be accentuating and aggravating some of the stresses associated with the pandemic. The first thing to note is that we also wanted to challenge or really look at different groups within the BAME category to look at how different groups may be faring. We found that participants who reported Black ethnicity, so being either of Black African or Black Caribbean ethnicity, reported facing higher levels of racism, which in turn was associated with higher levels of fear in relation to COVID-19. And then that, as predicted, was related to depression and anxiety. Racism was also, as we know from previous research, related to lower levels of British national identity. So the more that people report racism, the less likely they are to identify as being British. Now, what's really key is that during the pandemic, it's been framed very much as something that the nation has to get behind, that the nation has to be behind. And think about the Clap for Carers initiative that was introduced. It was about unity and us as a nation, as a community, confronting the pandemic. But actually, many people didn't feel part of that superordinate community as reported in our data. And what we're arguing is that when people are feeling discriminated, when they're feeling excluded from being British at that key time, this is also having an impact on how they're dealing with the pandemic and how they're responding to the pandemic. So what I really want to say is that challenging discrimination is as important as ever during the pandemic, where actually we can see an effect on people's mental health during what is a very sensitive time. Now, I'm mindful of time, and I did promise Lila that I'd only speak for about 10 minutes or so, so I want to just very briefly talk through the next part, and that is the knock-on effects for self-protection behaviors and preventative behaviors, because many policymakers have been really interested in how we can predict who is more or less likely to engage in self-protection, self-protective and preventative behaviors more generally, like wearing a face covering, engaging in social distancing. There was a great deal of discussion about why BAME people might be disproportionately affected by the disease itself. And so we wanted to look at differences between different BAME groups, comparing them also to white British respondents. We did a survey with 478 white British and BAME people in the UK. Again, we found differences between BAME communities. We started to explore other variables, other factors like political trust and trust in science and scientists. These are known to be associated with endorsing the guidance that is being disseminated by politicians and also by scientists. What we found was that those participants who reported Black ethnicity reported less political trust and less trust in science and scientists than South Asians. And that in turn was associated with lower intention to adopt preventative behavior. So what I'm saying is that when one is less trusting of politicians and also of science and scientists, one is less likely to endorse the sorts of behaviors that might be disseminated by these entities. And on the whole, BAME people had lower political trust. Now, it's really important actually to build trust in communities that might be disproportionately affected, especially as we begin to roll out the vaccine. But of course, to build trust, we have to address some of those underlying issues, which of course this event is partly designed to address as well. And that is racism, that is inequality, that is discrimination, that may be leading people to actually be less trusting of these entities. And we see that across a variety of groups that might be marginalized, that may be subjected to prejudice, such as in my other areas of research where I've looked at why there might be less trust of healthcare professionals among gay men at risk of HIV. Well, people who faced prejudice on the basis of their sexual orientation may also have trepidation and some levels of mistrust towards institutions. Briefly, I've also found in some of the work that I've done that minorities within minorities are very much affected by the pandemic. And I did a qualitative study of how British South Asian gay men were dealing with the lockdown and how, being from a collectivist culture, many of them had returned to their parental home during the lockdown after living away from home, and how they were dealing with some of the challenges that being in an environment where their sexual identity wasn't known to their family members could really affect them. What I found in this study was that many were fearful of involuntary disclosure of their sexual identity, fearful that their parents, their family members, that other members of their ethnic group might find out that they're gay, anxiety about the relationships that many of them had formed in secrecy because they were afraid of how their family members might react to them being gay. So what I'm saying is that during the pandemic, we've also got to be aware of some of the intersecting identities like ethnicity and sexuality and how they can produce quite challenging circumstances for people, thereby increasing their risk of distress, poor mental health, and as I found in this study, engagement in risk behaviors as a self-medicating strategy where they may not have access to social support because they're afraid of disclosing aspects of their identity to others. And very briefly, what I really want to also point out is that we understandably in the UK are talking about this pandemic and how it's affecting us in the UK. But actually, to address a global pandemic, we've got to think about how minority groups are being affected in other societies and in other contexts. I've had the great privilege of doing research with colleagues in Lebanon, where we've been looking at how sexual minorities may be at risk of marginalization under normal circumstances, but certainly during the pandemic, this may be accentuated. In societies that are already quite politically and economically unstable, how inequalities may be further accentuated during the pandemic. how in societies where group memberships, like religion, are really important mechanisms for coping with stress, like in economic stress, those identities can be less available to sexual minorities who may be otherized, marginalized, subjected to prejudice by members of their religious groups. And so what we found is that sexual minorities in Lebanon are reporting poorer mental health, much higher levels of fear and distress, and are generally suffering during this pandemic. Indeed, when we look at minorities within minorities within minorities, like refugees who are sexual minorities, in societies like Lebanon, we find even more significant effects. To conclude, I just want to make a few points that I think are fairly obvious, but hopefully I've provided some evidence for substantiating these points. Prevention is, of course, vitally important. Building trust is really fundamental. Inclusion and acceptance of marginalized groups are really important precursors of trust and prevention. We've got to look across various minority groups across society, which is why my presentation wasn't focused exclusively on just one minority group. I really want to point out that BAME is a useful category in some contexts, but actually what we found in the context of the pandemic is that different groups within this very broad category are responding differently, and there are different challenges that we might need to face and address. We've got to look at minorities within minorities. We must look beyond the UK to fight what is a global pandemic, of course, and very much in the spirit of the event that Lila has organised. Effective communication and education are absolutely key. Thank you very much indeed for your attention.
Thank you very much, Rusi. Thank you. If you could stop sharing, and we're going to bring the panel now. That's perfect. So if everybody would like to put their camera on, that'd be fantastic. And Vanda, would you like, you're leading the next panel. So the next panel is on employment. I think we need to respond to some of the point made by Professor Jasbal, and then maybe talk about the work that the Equality Trust does. And then we can go straight into the next session, which is looking at recruitment and employment support. Thank you very much. And we've also got some questions. Can you see the questions, Landa?
Yeah, I can.
Perfect. Thank you.
Great.
So Luke and Maria, can you turn your camera on, please? Thank you.
Great. I'm going to take the liberty of asking Rusi if he is happy to answer the questions in the chat, because I think in terms of time, sorry, not in the chat, in the Q&A, that would be really great if you don't mind doing that. And I think obviously, you know, you'll be able to give a much more extended answer. And thank you so much. I mean, the first thing I would say is that I was on question time last night facing some of these questions, and I really wish I'd had your presentation last night because that would really would have helped. But it's absolutely fascinating. And what I'm really pleased about seeing, because I feel like I spend half my life at least trying to say to people, can we stop working in silos? Can we please start looking? You know, none of us acts in one way. I don't act entirely as a Black person at any given minute time, or entirely as a woman, or entirely as a mother. You know, we need to look at intersectionality, and it is just so crucial. And I know I'm preaching to the converted here, but honestly, particularly within the third sector and within policy and government, the chances of actually having events like this and seeing this intersectionality are so low. And I think, you know, it's part of the work that all of us do to ensure that that intersectionality is visible and is taken into account, because otherwise we will just carry on making the same mistakes that we've been making. I think that the reference to trust is also just so crucial, and I think it's something that's really coming out in this debate now. And I think, you know, thinking about that relationship that our communities have with authorities and why they have that relationship with authorities, and it is different for different communities. And it's also essential to bring class into this, because, you know, within those communities, class plays a really important role as well, and those relationships with authorities. So, you know, we really need to make sure that we're looking at the full complexity of the issues, as you so wonderfully did in your presentation. So thank you very much for that. I'd just briefly like to say a quick word about the Equality Trust. So we are the national organisation, the national charity that works to tackle social and economic inequality, recognising those intersectionalities. And I think, you know, the one thing I would say that brings all of this together and that, you know, is really crucial for this day as well, and all of the work that we do, is that we know that in countries with high levels of income inequality, and let's face it, the UK is a poster child along with the US for inequality, and it's been going up, it will not surprise you, that we also see higher levels of crime, of violence, higher levels of incarceration. We see higher levels of teenage pregnancy, obesity, poor mental health, poor physical health, low levels of trust, as your research has demonstrated, and low levels of educational attainment or social mobility. And I don't have to tell this audience what that means for our communities, because that economic inequality is linked so much to the social inequalities that we see people facing. So we actually have such skin in the game to try and reduce inequality so that we can get all of those better outcomes so that everybody can flourish. Because I think one of the things people forget about inequality is it's not just about poverty, and it's not just about people who are at the bottom. When we tackle inequality, we make society better for everybody, because inequality affects all of us. So, you know, I'm really absolutely delighted to be here today, to be part of this, and to look at this event is looking at the varied aspects of all of our experiences and of all of the things that we need to do that are in our gift as well to make our society a fairer and more equal society. So that's enough from me, because we've got far more interesting panelists to move on to. I'm not going to introduce them in the spirit of a democratic panel and democratic day. I'm going to just very much be a light touch chair. But I will give them a bit of an order. So I'd like to ask Luke Davis, first of all, to introduce themselves and speak. And I believe we're going to hear about team diversification and recruitment.
Thank you, Wanda. Thanks, everyone. Great to be here. Just following on from what Cynthia said at the start of this session, BAME Recruitment was founded because of Cynthia's belief system. You know, first off, that she was hearing more and more that organisations were saying, well, the diversity of talent doesn't exist, or it's just not out there, or I can't find the people that I need. And the ideation of us as an organisation was born out of just refusing to accept that, and refusing to accept that there isn't brilliant talent from all parts of our society. So that was our ideation point. I guess in terms of my own journey, and just for anyone here who maybe hasn't drawn the connection, Cynthia and I are together, and I'm Cynthia's husband. So a big part of what we do is working as a couple, trying to create a better future for our daughter. And if you look at us as an organisation, we are relatively diverse. We have lots of different people, different backgrounds, different sexualities, different walks of life, and for us, that's what we stand for: is how can we level the playing field for everyone, really. I guess the bits that I wanted to share for the moments that I've got today is twofold, really, because I think the effects of the pandemic, but also what happened early last year with the George Floyd event, has meant that there's been and is being what I think is a seismic shift around the attitudes to employment, and particularly the approach of employers, whether that be the education sector, public sector, charity sector, corporate sector. There is change happening, albeit in many cases slow or difficult, but the change is there. And the big difference that we're seeing, and just to put it into context, after the George Floyd event, we don't do any business development as an organisation. That's not part of who we are or our philosophies. But the phone hasn't stopped ringing, and it hasn't stopped ringing for 9 months or so. So we've spoken to most CEOs, most heads of HR, most heads of EDI or DNI, in all sorts of organisations across the country. And there are certain universal things that are coming out time and time again. And I think what I wanted to share today was what I see are the two fairly large but should be surmountable challenges that I think if we can start to address, we can start to really solve this challenge. And I think part of the problem is there's so much advice out there around changing your wording on adverts, and we've got 2 job boards, and changing this, taking names off CVs, that, and it's all very tiny parts of what is a far bigger problem. And the two big problems as we see it is, or we see come out time and time again, is from an employer's perspective, and this could be whatever kind of employment that you have, is if you continue to only look for people where you're judging by experiences alone, and we all accept that privilege has meant that you haven't had the opportunity to have the same experiences, then how on earth are we ever going to level the playing field if we keep that in mind? What we have to do is reframe our assessment of what good looks like and give people the opportunity to show their capability, not just a long shopping list of badges or company names or organization names that they've collected. The second part would be, and this is why we see ourselves as really kind of sitting halfway in this equation to be solved, is that from a candidate point of view, from an employee point of view, you also, I think, have to start to realize that the organizations are beginning to open their doors, but they're opening their doors in quite an uneducated way. They don't understand, they don't know what they need to do, but they are opening up their doors. And I think one of the things that we see as a struggle, and we describe it as self-disqualification, is the really big impact of people ruling themselves out for opportunities before they've even got past applying to the job. And we would really love, and we know it's not easy, but if you look at any of our social media channels and things like that, we're really wanting to give people belief and confidence, because you have to put yourself out there, and you probably have to get used to rejection, and you probably need to have some bad experiences. But unless we can start to close that gap between employers that are trying to be different and people that for whatever reasons maybe think that the opportunity is not for them, we're never going to address it. So I guess there'd be the two things I wanted to share. So thank you for giving me the opportunity to do that.
Thank you, Luke. That was a great opener. I'm sure there'll be many questions and much more to pick up on that. So thank you for that overview. I'm now going to turn to Elizabeth Andrews. Who's on mute? Sorry.
Sorry, guys.
We've all been there.
Yeah, I'm Elizabeth Andrews, the founder of Fuse Developments, which is a training and mentoring coaching consultancy. I'm just going to share my screen. So my presentation is very brief because I've got like 2 or 3 minutes, and just following on from what Luke was saying, I can say that I'm guilty of talking myself out of applying for senior roles on the basis of talking myself out of it. You're not qualified, you can't do that because you're not a white middle class male predominantly. So my background is in education. I've spent 20 years working in the lifelong learning sector. So I'm just going to show you some statistics on what that environment looks like in terms of opportunities for BME. So there's been a sharp decline in BME college leaders. This has been going on for two decades or so. So it's 13% down in 2017. So BME students have gone up in numbers. So the representation there doesn't quite equate, which is quite, it has a knock-on effect on the attainment gap with BME students. And out of 239 colleges in the country, there's only between 12 and 14 BME principals. And in 2019, there were 535 academic people that worked in top managerial positions. And out of this number, only 475 were white, which is quite a massive number. So this has been, as I said, it's been an ongoing issue for years, and it's what led me to leave the industry and start my coaching and mentoring company, because I believe coaching and mentoring is really a good way of helping to remove these barriers to discriminations. I know there's lots of initiatives at the moment where there's lots of programs to get people in BME backgrounds into senior positions, but I'm going to be speaking a bit more on this in my workshop at 4 o'clock. So if you'd like to know more how we can remove these barriers in the workplace and promote, you know, people from BME backgrounds in more senior roles, come and join me and you can hear much more. Thank you.
That's great, thank you. And I would urge people, if they have questions, please do put them in the Q&A, because we will have time for questions this time. Thank you, Elizabeth. And now I'd like to turn to Maria Goldsmith, who's going to talk to us about something really important and something that I think most employers really, really do need tattooed in a very prominent place, and that's duty of care.
Thank you so much. My name is Maria Goldsmith. My company is Goldsmith Counselling and Mediation Services, and I certainly see an awful lot of stress in the workplace. And some people don't realise, and in fact some employers don't realise, that they actually have a legal duty of care. And I'm also going to attempt to share my screen. So legal duty of care in the workplace. This is not something that employers can actually opt out of. It's a very statutory and in fact legal something they have to adhere to. It's actually the Health and Safety at Work Regulations of 1999 and the Health and Safety Work Act of 1974. And as I said, it is statutory. They have to abide by it. The Health and Safety Executive takes a very measured view on this. And it actually helps employers to look into it in a very structured way. Because what they recognise is that stress in the workplace is a very serious issue and it had to be addressed. And there is evidence that directly link that stress in the workplace has an effect on people's mental health and their physical health, and can also lead to, unfortunately, some social problems and harmful practices, as in alcohol and drugs and things like that. And it also has a knock-on effect to people's employment. So we're going to look at the reasons why, not just the legal side, but actually the reasons why employers should be looking at why they have to adhere to the Health and Safety Act. So if we go back and look at, and if we go back and look at, there is a statutory, as I said before, and there has to be a principal duty holder, and there has to be information to the line management to show that line managers have a responsibility. And in fact, if they go away from the policies, they can actually be privately prosecuted or prosecuted in a criminal court of law. And that has actually happened. So what the Health and Safety Executive has said is that, number one, if an employee or a group of employees actually say that they are suffering from stress, the employer has to identify the risk to the employees. And this under 6, it's called management standards. And they look at the demands. So that includes, what are the workload? What are the work patterns? What's the environment of the company like? The control. How much control has that person got in the way they work, in what's expected of them? How much support have they got? As in encouragement, as in leadership, as in resources by the organisation. And very important, as our subject here today, the relationships at work, avoiding conflict. Are there any unacceptable behaviours? So very much so, if somebody is receiving what they feel is unacceptable, behaviours by somebody else, or prejudice, or anything like that, under the health and safety, under the management standards, this has to be looked at. This part is not law, however, it will be looked at, as in the Health and Safety Executive and, in fact, the employment tribunals. And also the organisation, what they, what their role is, and are they able to deliver it, and what changes in the organisation people can actually expect, what support there is, and what's going on. They then look at, so that's number one. Number two is who can be harmed and how, and that's again what they look at. Number three is that you evaluate the risks. And number four is extremely important, you record the risks. If you don't record risks, then actually in 4 years' time or 4 months' time, when people say what happened, if you don't have it down, then again, you can bring the organisation or, you know, it doesn't help the person making the claim if the findings aren't recorded, and then monitor and review. So as we can see, and this is a slide that goes through: identify, decide, evaluate, record, and monitor. And preparing the organisation pre and post, again, is very different. Why should employers, not just because it's legislation, but why should employers also do it? Well, sick absence. If we think about how much sick absence costs, and some of the you know, nearly over 50% of people are actually off now with stress rather than some kind of other physical. Productivity goes down, and not just the productivity, but the stress it puts on the people who are still at work. The grievances, disciplinary complaints. For a HR department, the hours that is cost, again, it's not just legislation that is the driver, it's the internal cost to the organisation that really should force them to look at this. And again, not just the legal. Accidents. If people that are stressed, they have 40% more likely to have an accident than people that aren't. That's quite shocking. The reputation of the company. It's not just people who are being affected by the stress at work. It's the families that are watching. It's the friends that are seeing people say, I wouldn't go and work for them. And employment tribunals. So as you can see, there are many reasons, and not just legislation reasons, why people should, or employers need to look at the cost of stress at work. The Walker case, I would suggest you look it up, but very briefly, Mr. Walker was a social worker. He went off with stress. He had treatment and medication. He actually came back to work on a rehabilitation program. There was a restructure. The rehabilitation program was forgotten about. Mr. Walker was just put back into his original job. So it was foreseeable. And that's the key word, that he would go off again. He did go off again. And he took them to an employment tribunal. And it was a very significant, it was one of the highest costs back then. And he changed the way employment tribunals went forward. So this is just a very overview, and I will be talking about stress a bit later on, and the effects of on personal and what people can do, and certainly to uphold organisational reputation in the workplace, because if it's known that if there are problems at work, organisations will look into it, and not just because it's a bad legal duty. It's certainly a win-win. Thank you.
Thanks, Maria. That's really, really useful. And I'm sure that all of us are identifying with different parts of that presentation, whether we're employers, whether we're employees or workers, and we've all taken something from that. So thank you. We've started at the beginning of the journey with recruitment. We've moved on to, you know, potentially coaching and mentoring for promotion, let's hope. And then we've also looked, as we have a responsibility to do so, at how we can equip ourselves for when things do not go well. And I would add to that, you know, make sure that you're in a trade union as well, and that you draw on the support of trade unions and their colleagues and their equality reps as well. But I would say that, wouldn't I? Because I've spent over a decade in trade unions and I'm a bit of an employment law nerd. So thank you for all of that. I'm just going to have a very quick question to Luke and Elizabeth, and I really would appreciate quick answers because I know we've got a couple of questions for Maria, so I'd like to bring back in Luke and Elizabeth there. I mean, Luke, I think one of the things that's really essential, especially when people get to a certain level as well, is the engagement of headhunters. And there are notorious not notorious. Sorry, that's not a good name. There are headhunters known in the sector who claim to be working on diversity. I mean, how we've seen headhunters actually go sort of further down a chain in a sense. It's not just CEOs now. It's very much sort of policy level or in those sorts of organizations. So do you see this as a positive thing, because it means that organizations can direct themselves to people who've got more recruitment expertise? What do you see as the balance there?
That's a brilliant question. I think we're seeing a trending shift. There is less reliance generally on recruitment agencies, and it's a big thing that we talk about a lot around the kind of the people's credentials when they're talking up D&I, and I don't like the fact that people's demographics are becoming their skill set almost, and it's making sure those two things stay separately. So I think there's a shift in a trend. I do fear, though, and we're normally optimists, but I do fear there's still a bit of a closed network around the really senior positions and the really senior headhunters. And even we feel it a lot as an organisation. And I've been head of talent for PwC's, Deutsche Bank's, and we don't get a look in because we're seen as a kind of small niche specialist agency. I think there's still a long way to go. What I would urge, though, is that particularly in pandemic, people don't have a lot of money to spend on recruitment, or organisations don't. So actually, your ability to build your own networks, if you're brave enough, or confident enough, or navigate sophisticatedly enough, I think there's other ways that you can get those opportunities.
That's really interesting. I'd love to have a chat with you about that offline here. But I think one of the key things is, how do people, because it's word of mouth, isn't it? Let's be honest. Somebody recommends you, you get asked if you know somebody for a job. And I guess it's about us making sure that we use all of our networks, and we're not afraid to do that. And we make sure that we are passing that baton back to, the people in our communities, so that it's, because we do get approached a lot. Once you're a name out there, everybody comes to you, and it's really about passing that back. So absolutely great, thank you. And Elizabeth, I feel like I have a finger in every pie here, because as a former academic, one of those people who's not in the statistics, because so many people didn't actually get to academic posts. It's really frustrating to see that. And seeing that the AOC has no data on their principals, I mean, where as well do you see these need for data? I mean, we're always told we need the evidence base for making our case, even though we know anecdotally, we know within our communities what's happening. So how do you think they can improve those aspects?
There are lots of, is that feedback from me? There's lots of initiatives in the education sector, but I don't think that we've seen the impact, because there's lots of leadership, development, mentoring programs that have happened in the past, but I'm not sure of the effects of these initiatives and the impact that they have had. So I think there is work being done, and lots of organizations do have like mentorship schemes, but we haven't seen the impact. And this has been happening for like 20, 30 years. And yes, I think there really is a need for data, because with data, that is your tangible proof that something needs to change. And there is this kind of like workplace discrimination and marginalization in FE and HE with BME teachers and leaders.
Thank you. I think you're absolutely right. It's a bit like reports and commissions, isn't it? We can count those, but we can't actually really count the impact that they've had, funnily enough. Thank you for that. I'm going to come in with the 3 questions that have been posed to Maria, and I am very conscious of time. It's one of my foibles as a chair to be very, very hot on time. But Maria, there's 3 questions here, one of which, of course, is simple for you. I know this. If you're not considered an employee but a worker, does the company you're working for also have a duty of care? So that distinction between your work status, which can be absolutely crucial, especially in employment tribunal cases. Has Brexit changed any legal rights for workers? I don't think we're going to get the full answer on that in about 7 minutes. I'll just warn Lottie right now. And are minorities impacted disproportionately by stress?
By stress. Well, there's quite a bit there, and I'm not even going to go into Brexit, to be quite honest.
Do your best, Maria, do your best.
I will always do my best. And, with regard to employment status, it's come over, and Wanda, I'm sure you're even more of an expert than I am, but, people who are casuals are now considered under the employment. So yes, if you are suffering from stress at work, as far as I'm aware, you are covered by the legislation. And very, very much so, you go through to your manager, you put it in writing, and you ask them to and you can even quote the legislation. In fact, you can go on the website of the government and quote it at the employer, contact HR. The unions, of course, are phenomenal, and say, I am feeling stress at work. Can you help me, please? And there will normally be a stress policy or some kind of policy that will cover it. And again, very important for you to use, because then your employer has a duty of care and your manager to look at the policy and certainly look at how they can help. Now, the difficulty is all the jobs stressing them, but it's actually what you're feeling, and they should be able to make some kind of assistance to you. And occupational health, is there an employee assistance program? Can they take some work off you? So very much so. But and I'm not plugging it. If you want to, please come into the workshop this afternoon and we can really look at it. And I don't want to take up everybody's time, but certainly, yes, you are covered as far as I'm concerned. The Brexit employment rights at the moment, and I will just touch on it briefly, you have the same employment rights, but again, we don't know how much of that's being changed in the future, but nothing has changed to my understanding at the moment. I think that covers it all, apart from...
I think then there was a question of minorities impacted disproportionately by stress, which may not be within your...
No, it's
area.
not. But
sorry, go on.
One thing I can say is certainly, I've been doing this 25 years, and I would say, just on the, if you look at the stats, I think yes, they are, and I think we showed earlier about COVID and the stress effects of that. But I think yes, the stats say, and certainly for 25 years, I think yes, they are disproportionately affected by stress, because it's about authentic self as well. And sometimes, and of course, the inherent racism that can be found, unfortunately, whether it's unconscious bias or bias. Perhaps I shouldn't say that, but I will. So I hope that covers it.
Great, thank you very much. Tamara has a question, wondering if we knew of any research or evidence for the most effective methods to ensure equity in employment, e.g. educating employers, having effective anti-racism groups in addition to policy. I would invite everybody at the conference to pop in answers there, because I'm sure that there's a crowdsource here of information that would be able to help tomorrow with that. I'm just going to turn to each panelist to say one last thing, and thank you for plugging the workshop, Maria. This is absolutely fantastic and what we're here for, so don't feel bad about that. And again, there will be workshops this afternoon, so please do look at those and decide where you're going. But over to the panelists for just one very quick last word. So I'm going to go back in order that we started with. So Luke.
Thank you. I don't know if I could do one word, but two very quick messages. Employers, unlearn what you've done before, think differently. For job seekers, keep the hope. I know it's not easy, but keep the hope.
Great, thanks, Luke. Elizabeth, words of wisdom from you.
So words of wisdom from me, I think we need to all be the change we wish to see, and we need to work collectively together to remove and disrupt barriers that BME people in the workforce are facing in the 21st century still.
Thank you. And Maria?
Don't suffer in silence. Shout.
Absolutely fantastic, and I can't believe we have finished on time with a minute to go. So Lila, I'm looking to you to take advantage of that minute.
I want to finish off with Rusi actually, because I think he started up his research finding were really insightful, and I think it's really important to have the theory and practice going together. Do you know what I mean? See, I think that they feed each other. So Rusi?
Yeah, I completely agree. I think I wouldn't be doing this research if I didn't feel that it could really inform practice. And I think that's why opportunities like this to really communicate with people who are working on the front line, so to speak, with people directly, so that academic research can be translated into practice. I really think that we can all be doing something. Interventions have got to be based on evidence, because they're more likely to be effective if we've got some evidence that have gone before that. But I think just my final words really on this topic would be that we've just got to acknowledge intersectionality. We've got to acknowledge that that no individual is just a single identity. We are all very, very unique, and we've all got multiple identities that are at play, and we've got to be aware of the diversity around us and not really make assumptions that homogenize people, that sort of generalize them excessively.
I agree with you. And I think for me, the identities are like a pyramid. So at the top of the pyramid, you've got like the white, very privileged cisgender man. And then the more of the Equality Act and the protected characteristics and beyond, I think Vanda was talking about class. It's not a protected characteristics, but it very much comes into play. So if you're Black and you're trans and you've got a disability, it just multiplies the barriers that you've got within society. I want to thank you all profusely. It's been my absolute honor and privilege to really organize this conference and work with you. You are phenomenal people and really influential people. Vanda, I'm going to give you the last word before we go on to the next session.
Just as I've muted myself. No, the privilege is all mine, and it's great to hear those different, to start with the research, and I entirely agree with Rusi. Our work is all about translating that research into campaigning materials, into campaigns, and to try and influence policy and make the world a fairer place, make the UK a fairer place. So as we all work together to achieve that, we can only get more powerful. So thank you very much, and amazing work, Lila, for setting all of this up, of course.
Thank you. Coming from you, it's a massive compliment, actually. I look up to you big time, so thank you for joining us. It's like mutual appreciation society. I was gutted I couldn't get you at the last Educating Out Racism, so I got one of your trustees, Priya, and if you missed the first conference, actually it's on YouTube, so if you just go and have a look, and it was just equally insightful. So I'm going to thank you and let you go, because I know you're super packed. You're just hopping virtually all over the place. Am I right?
Can't catch me anywhere. But thank you. And I hope everybody enjoys the rest of the I know everybody will enjoy the rest of the conference. So thank you for letting me be a part of it. And good luck to everybody. Have a wonderful weekend when it comes. Thank you.
Thank you. So yeah, that was interesting, wasn't it, Andrea?
Yeah, that was very, very informative, very informative. I learned quite a lot listening to all the speakers.
So would you like to introduce yourself? We've got a little bit of an interlude with a performance from you. I'm really excited to have you.
Thank you, Lila. I'm Andrea Leanne. My pronouns are she, her. I'm 39 years old. I live in Walthamstow, East London. I'm an inspirational speaker and poet. I facilitate writing workshops. I run two open mics. One's called Poetry LGBT open mic, and the other one is Adult Survivors open mic. And I tend to make sure that diversity and inclusion is included in all the spaces that I create. I reach out to everybody and say to make sure that I provide a welcoming and inviting space where people can be their authentic selves. It's been challenging over the years, but the more that we consciously do to include people is the more that we can make a change. And during my work experience, like listening to this conference, I was reflecting on my time at work. I spent 7 years in the NHS at band 7 level, and there was so many times where not only I would come home frustrated and angry and stressed by the work, but a lot of the time it was about how just being Black in certain positions within the NHS carries all of its challenges. So for example, being the only person of color in a meeting and turning up to this meeting and people looking at you like, are you in the wrong place? Like,
oh yeah, we hear it in the news all the time. Even people in really high position in the Houses of Parliament who are Black are being mistaken for lower levels jobs. So you're an inspirational speaker. I've dropped in the chat the link to your new collection of poems called Charred, and I think you've got a poem for us.
I do have a poem. I do have a poem for you. It's called Same Difference. And I wrote this poem because writing is hugely, hugely important to me. It's helped me as one of the coping mechanisms over the years to deal with stress and anxiety and various challenges. It's called Same Difference. And what I want you to do is just, while I'm reading this, I just want you to focus on what I'm saying. Stare at me, please. Check out my hair. It's the texture of rough cotton before it's relaxed. Stare at me, please. My brows are a few shades darker than yours. My lashes shade and protect my eyes as they do yours. Look into my eyes. Tear ducts in their corners where tears fall, stream and gush. Stare at me, please. Check out my nose as it's uncommonly smaller than yours. Check out my lips as they too were made to kiss and pout the occasional lipstick. Tell me if we don't breathe the same way as I take a gulp of air into my lungs and breathe out. My neck, my arms, my elbows. This finger too awaits that special ring. My breasts, my back. Cut me some slack as you check out my fat. Now focus on your own feet. Mine are more or less the same as yours. 10 toes, arch heels, and a callus or two. Me, you, they, her, and him. Please, check out my skin. Sweet, shea buttered melanin. Cut me deep and see if we don't bleed the same way. See if my blood goes from dark to red when it hits the bed. Stare at me, please. Stare at me, please. Stare at me, please, while I stare at you. Yes, there are so many similarities. Now you tell me if we're so different. Thank you. And Charred, A Survivor Speaks Her Truth to Inspire, is available in Gaze the Word bookshop in London. It's also on their website. It's on Amazon. It's everywhere.
Thank you, Andrea. I've put it in the chat. People are commenting, beautiful, inspirational as usual. I mean, you're always a pleasure to have. Thank you so much for sharing. And I liked when you post, because the next workshop, we've got Alison who's going to talk about mindfulness and meditation. So that's someone is saying it's awesome. So we're going to give you a little bit of a break, because I think there's so much information to digest, but I wanted you to be part of this conference because I think you're a phenomenal speaker, but B, you also bring like the human element. So thank you so very much, Andrea. And we're going to take a little bit of a break and come back at 15:15. And while we're taking a bit of a break, I'm going to bring the next panel in. So thank you very, very much, Andrea. And no doubt see you very soon, either on television, because you're on BBC very recently, or
Thank you, Lila.
Thank you very much. So I am promoting you to an attendee if you want to stay in the conference. And I'm now going to bring Amy from the London Metropolitan Archive to join us. Alison, Nafi, so we're having a bit of a break. Fantastic. Patrick, I saw you in the audience. I'm just bringing you up. And as you would have seen from the program, for this panel, we do have a little bit of a survey. So if you want to go onto Slido, I'm just going to share the screen so you can see the codes. Oh, people have already commented. You are fantastic. What a lovely audience. Oh, that is so good. So we've got 2 active polls where we're asking people to give examples of belonging activities they've carried out in the workplace. And we've also got what does belonging in the workplace mean to you? Being valued, being authentic. So thank you very much. So basically, you have two Slido. You've got one which is hashtag 76102, where we're encouraging you to let us know what belonging means in the workplace. And the other one, which is looking at examples of activities carried out in the workplace, whether it's in your college or school, or if you're not working at the moment, maybe where you have worked before. So I think we've got the whole panel now. Let me just check that I've got everyone. So we've got, oh, Veronica, sorry. Just need to double check, make sure we've got everyone. It's such a fantastic panel. Yes, I think everybody's here. Fantastic. So we'll start in about 5 minutes, but if you want to talk and reflect on the previous panel, you're more than welcome. So my name is Laila El-Metwi. I am the founder of Educating Out Racism. This is my second conference, and also Pride in Education. I'm Stonewall Lesbian Role Model of the Year for 2020 and Pride 365 Champion. And I specialize in delivering equality, diversity and inclusion workshop. I'm a teacher and a teacher trainer by trade, and my curricular background is in ESOL, English to speakers of other languages. And I've got 30 years experience of supporting LGBTQ plus communities, as well as refugees and people seeking asylum, rather than asylum seekers. And we don't use that term anymore. It's dehumanizing. So welcome everyone. And thank you very much for joining us. Nafi, would you like to introduce yourself?
Hi everyone, yes, my name is Nafisa. A lot of people call me Nafi, and that's fine. I'm the National Co-Chair for Natekla, and I'm also a Senior Manager. I'm Head of Life Skills at ELAT, which is an education charity in Hackney and across London. And I recently finished my doctoral studies and gained my doctorate from the UCL Institute of Education. And today, in a moment, I'll be delivering a session on my research and what I found,
which is on the theme of belonging. So just before we start, let me see what people feel belonging means to them, because I think that'll be a really nice introduction to your keynote before we take the panel. So people are saying, if you can't access Slido or you're using your mobile telephone, then you can just drop it in the chat. So belonging means feeling valued for being authentic, feeling that you are accepted and valued, comfort. So thank you to the 3 people who responded. And then give one example of belonging. So we have flat structure. In my place of work, we work collaboratively and decisions are made as a group. Everyone's opinions are heard and valued. I want to know where you're working and I want to join you. Amongst other activities underway, the exciting new one is a series of discussions from the FE sector and the communities about lived experience, involving student, staff, community leaders and experts hearing story, creating BAME groups to hold the organization accountable. Staff networks are actually a really, really good way to empower people in the workplace. In my previous employment, I was the chair of the LGBT plus staff network at Tower Hamlets Council called Tower Pride, and it did make a difference to the way LGBTQ plus people were treated in the workplace, and led to some significant changes. We did a pay gap analysis, as well as changed the policy around trans inclusion. So it is really important to use staff networks. We'll revisit them a little bit later. So 1515, without further ado, Nafi.
Thanks. And so I'm just going to share my presentation. So I've chosen to, rather than do a PowerPoint, to type up my presentation just for accessibility, and I'm very happy to share this later. So thanks so much, Laila, and thanks to everyone on the panel for letting me come on here and talk about my research. I'm really excited. It's in, as Laila said, it's about belonging. So my recent doctoral studies were on this concept, and I looked at social interactions for the people I was working with and how that supported them to feel that they belonged in the places that they were settling in. So I came into ESOL, the same sector that Lila talked about, English for speakers of other languages. And when I came in at a time when there was an increase in hostility towards migrants and refugees. And I felt this was very much fueled by racism and xenophobia. I was working on projects to support integration, and I was interested by what was meant, by this term integration. And I also felt that the voices of the women that I was working with were not heard in discussions about integration. So my main aim of taking up research was to present alternative narratives into the political and public discourse, as I recognized that this is what was influencing policy making at the time. As I mentioned, the term integration...
Sorry, Nafi, is it possible to maximize a little bit? It comes across as like really, really small on the screen.
Sorry, I did
apologies.
try and turn it up, but let me just...
Yeah, perfect.
I can do it like this. There you go. Sorry about that, everyone. I'm really glad for that feedback. So as I mentioned, this term integration was a difficult one for me. And I think a lot of people also understand different meanings of it. Well, for I considered it to be a process where all groups involved have a part to play and have change to experience. And this could be people who are moving and settling themselves, but also government and people who live in those areas already existing settled communities. But what is belonging? So Lila already pulled up some answers that some of you gave about belonging, and I saw some more in the chat. And so I want to thank you very much for all those contributions. And actually, a lot of them are very similar. And the definition that I came to use with my research comes from Vanessa May's concept of place belonging. And she says that belonging is a sense of ease with oneself and one's social, cultural, relational and material contexts. And belonging is built upon the basis of your relational self, that our identities and our sense of self is formed based on our relationships with others and our environment around us. Belonging is a concept that has become more known in schools. There's a team at UCL Institute of Education, and they published recently a paper, and they said that very similarly to Vanessa May's concept of belonging, belonging is relational, it's cultural, it's geographic, and it's a dynamic concept. It's that sense of being somewhere where you can be confident that you will fit in and feel safe in your identity, a feeling of being at home in a place and of being valued. So some of the responses that you gave earlier, being your authentic self, that's part of that. Feeling safe, that's part of that. Being involved, definitely that's part of that. But I think there's much more. You are not just involved, you are part of creating that space as well. And I think when I was thinking about work and employment support in the first session we're talking about, in the past, there was this term stretch and fit when recruiting. And there was the idea that you recruit people who can fit into your organization. As I've learned more about belonging, I've really recognized how actually the organization needs to change to take into account people who are joining an organization rather than only look for people who can fit into that organization. So this idea of a place that you can fit in or being at home is dynamic and changing rather than a destination that you fit into. And I think thinking about belonging that way has really helped me then step back wider and think about, well, what does inclusion mean and what does creating that kind of space mean for us, and to make sure that we can include as many people in it. And they say belonging can shift rapidly into not belonging, and that can have quite damaging consequences for individuals and society. The team at UCL have just conducted a first phase of school-focused inquiry on belonging and exclusion, and they've said that exclusion can be caused and happen in many ways as well. Like we've heard throughout our panel earlier, intersectionality is something we have to start really looking at. And so this team also says that racism and xenophobia is one type of exclusion, but then inclusion and exclusion is intersectional. So we need to look at all the other factors that might come into play. So in thinking of exclusion and inclusion, I think it's useful to think to look at a framework of belonging. As I mentioned earlier, belonging is a dynamic concept and is experienced from many aspects. I found that Vanessa May's concept, and where she theorizes 4 aspects within this framework, was very useful for me when I was thinking about my students and people I was working with. So there are 4 that she talks about, which are temporal, material, physical, which are kind of which are the same aspect, cultural and relational. So I'll start with temporal, as I see this as a basis from which other aspects develop. This starts with the things that have influenced the existing identity someone has, and it takes into account a person's life histories, family histories, and also could include generational trauma that they might have experienced. The second aspect is material belonging. This takes into account the places, it's physical in some ways, the places that we are, the places of being and belonging. So for me, I use an example of the ESOL classroom. Research shows that the physical world in space can affect someone's feeling of belonging. For example, when someone attends a class, when someone is in that, rather than them thinking of their ESOL class as a building with 4 walls, they usually take into account the interactions that happen within that when thinking about that place. I think about how we organize each other in a space, in a classroom, what rules we have with each other, ways of behavior and expectations. They're all wrapped up with the idea of a place. And so when we think about kind of our experience being in an environment, visual visibility and representation is very much a part of this. So if we're trying to support material belonging in our places of education and learning, or even in our workplaces, there are some questions that we might ask ourselves to see how we're doing. Is the place a welcoming place? A place that accepts difference and diversity? I remember when I was in one college, we had to always teach our class within another curriculum area's classroom. And so we weren't allowed to put any of our group's work on the wall. There was nothing in there that my group could identify as being their place. How did that affect their feeling of belonging in that place? What does a welcoming place look like? What are the physical markers? And I think if we think about that, then we can try and recreate places that can make people feel accepted and welcome. The next aspect I want to talk about is cultural belonging. This is the particular and distinctive ways of life of a group. And sometimes you can hear it expressed as, this is the way we do things around here. Yeah, especially in a workplace, you might hear that. But how do we make sure that we are developing cultural belonging so that it's not just one group and that it takes into account the multiple people within this group? So questions that we could ask is, whose culture is it that we're talking about? Whose stories are being included? Cultural belonging and systems can be exclusionary. For example, in ESOL, the value of multilingualism within our English lessons has been slow to become accepted. I know that even as recent as 5 years ago, trainee teachers were still being told that if they're in the ESOL classroom, there should only be English language used, and that's sort of what we told students. Yet there's so much research. I've put 2 names down, Mel Cook and Rob Putrell's names. They've done so much research to show that there's a lot of value in celebrating and incorporating multilingualism in our lessons to support our students' progressions, but also, to support part of that identity building and for them to feel accepted and that they belong. And what do we do about multiple belongings where someone is part of a certain group and then part of another? I think this is where those ideas of intersectionality really come in. I still think there's a lot to do in this aspect, and it's that real understanding that there's a genuine exchange of ideas or culture rather than making one group fit into another's. And finally, another aspect which is really important is relational belonging. And this is about our relationships with others. Our families are usually the first place that we feel belonging. I say usually, it's not always the case. And that's because of the relationships we build with our families ever since we're really, really small. But relational belonging links with very much with social capital theory. This is the theory that we all have resources or potential resources that we get from interaction and participation in a group. So the family, which I was talking to you about earlier, is a really common type of social capital, which is bonding social capital, but we also have bridging social capital. Bonding social capital is usually gained from the relationships that you have with people who are close and similar to you. And you might feel, you think the same things and you like the same things, and that becomes kind of a basis for that relationship. Bridging social capital involves links between people from different groups. Sometimes this can mean people from different social backgrounds, nationalities, ethnicities, but then we talked about class earlier. It could be something to do with that too. Bridging is important because what it supports us to do is to develop relationships with people we don't know very well, where the context that people live in, experiences that people have, are things that are potentially unfamiliar to us. But it's so important in developing trust. And one of the presentations earlier, Rusi was talking about kind of how important trust is. Well, actually, a lot of what belonging looks at is how we are developing trust in each other, in other people, in our environment, and also in the knowledge that we can do certain things and the expectation of what the achievement will be from those things. So a question I think we can ask ourselves, how are we creating environments in education, in our workplaces, that support the development of relationships and trust? My research showed that social interactions with people in their communities supported the women in my research who were learning English and settling in the UK to feel a sense of belonging. The social interactions they had with people who were different from them, but living in the same community as them, helped them develop trust in others and to feel safe and at ease in their communities or classrooms or places that they had to go and receive services from. One of the places they reported feeling most comfortable in was their ESOL class. So I'll hand over back to Lila, who's about to start the panel. But I guess the question is really, how can we as educators, education leaders, support our learners, students, young people to feel a sense of belonging within their learning places? And I know some of you have already shared quite a few practical things that you've done. And I think we can compile those and share them wider if we can't read through all of them, Lila. Thank you. You're on mute.
Thank you. Yeah, I keep on. You're on mute, you're frozen, your connection is unstable, I think are probably the three most used sentences over the last year. Thank you, Nafi. It really brought me back to my earlier days as an ESOL teacher. I think you talked about safety. That's really important, and about feeling valued. But for me, it's always been about celebration and showcasing. Visibility is really easy to do for the LGBT community because all you have to do is stick a rainbow flag or a trans flag. It is tokenistic and it isn't. But I think for Black and ethnic minority, it might be a little bit, well, you're going to have like 500 flags of all the countries. I just wanted to share, because you asked for an example, so I came prepared. In 2016, I organized an ESOL museum where I asked all of my learners to bring an object that represents their culture, their identities, their cultural background, and that was being displayed at the center of the college, and everybody who came in could actually see, and it was catalogued, and it generated a conversation. So I think it's about thinking outside the box. It is about them and us, and it isn't, if you know what I mean. So, but people need to definitely put their thinking cap on and make a conscious effort to acknowledge their bias, acknowledge the trauma, and try to be a little bit more compassionate, if you know what I mean. And English only in the classroom, I'm glad this is going, and it's not just about that. I think we need to be celebrating the multilingualism that has built this country, And if you're available over the next couple of weeks, I'm giving a couple of talks at the National Maritime Museum, where we're specifically focusing on looking at the contribution that refugees and migrants have brought to this country. So thank you, Nafi. That was really insightful. I'd now like to invite Dr. Patrick Vernon, who's a phenomenal activist for whom I have the most amount of respect, and the author of 100 Great Black Britain. Thank you, Patrick. And then I will invite Amy, Veronica, and finish with Alison, if that's okay.
Okay, hi, good afternoon, everyone, and it's really great. Layla, you're a star. What do you do? You got, you know, you're
Lilac, please. It's like the color lilac without the C. Lila.
Lila. I should know
Thank
better.
you, Patrick.
But it's fantastic. This is like a follow-up to the successful conference last time, and so it's great. So it's really interesting around the whole stuff. I want to kind of pick on the whole stuff around belonging. It's really important. I wrote the book 100 Great Black Britons with my co-author, Dr. Angelina Osborne. And in many ways, when we talk about belonging, it's still perceived as a white middle-class privilege in this country. So, and then when we talk about belonging and to share our multiple identities and the whole stuff of intersectionality, it becomes a bit uncomfortable and a bridge too far. But, you know, I think what's quite clear, especially in the whole pandemic situation that we're experiencing, is, you know, it's important that we articulate our sense of belonging. That is why there's still lots of mistrust with a lot of people in Black and Asian communities not taking the vaccine. That's why there's still a lot of mistrust in people trusting authority, because the way that we've been treated and not respected, if not for decades, centuries. So I think the stuff around belonging is really, really important. I mean, I was involved in a campaign called National Windrush Day, which now has been adopted by the government, even though it's the original objective of that Windrush Day was it built on the work done by the organisation like the Windrush Foundation and the late Sam King, who was on a Windrush ship, which docked until 1948. And even though the majority of the passengers were from the Caribbean, it was actually a multicultural ship. You had white people on that ship. You had people from Malta on that ship. You had even people within the Caribbean of mixed heritage, mixed identity, and Indian heritage. And I saw, in many ways, that ship was a multicultural ship. But and the idea of the National Windrush Day was to celebrate migration, to in all migrants coming to Britain, basically, which I think is quite important. But unfortunately, because of the Windrush scandal, and the government did adopt the National Windrush Day, they've only focused on the Caribbean community, which I think was a missed opportunity, because really Windrush is a story about all our migration histories. It's a story about struggle. It's a story about resilience. It's about stories around courage. When you leave your whatever part of the world that you've left family behind, siblings behind, maybe even children behind. You may have been forced to leave, and that energy, that resilience, all makes all of us, in terms of the whole stuff around belonging, is really important. So I hope that Windrush Day, moving forward, will still reflect that multicultural, intersectional aspect of British history as well. I think that's quite important.
I've just put your book in the chat, because I was really interested how it's been used for competition in schools. Like, I really wanted this workshop to be really practical, so people walk away and go, "Oh, I can do this."
So on a practical level, so you know, I'm a pragmatist as well as a campaigner. So when I did the campaign 17 years ago, 100 Great Black Britons, we had a schools competition, and it was just simply inviting schools to celebrate Great Black Britons, and with entries from primary schools, secondary schools as well. And we probably had about 100 entries, wasn't a lot, but actually what was interesting was the range of quality of entries from different schools. And then we went to visit, me and my colleague Angelina, who was working with me doing the research work around Black Britons. We went to visit a number of schools around the country and gave them prizes, etc. with the launch of the book last year, I decided it was important to do another competition 17 years later. And just to announce, the closing date was December. We've received 1,500 entries from schools, from all the key stages 1 to 4, with a competition for 16 to 25-year-olds. And also we had a special category for preschool. And I'm just in the process of putting together the judging panel. I mean, 1,500 entries. I mean, there are all videos, you name it. We've got a whole range of stuff. It's going to take a lifetime to go through these entries, but I think I'm looking forward to it. I've looked at some of the clips, and one of the clips I love so far is a 5-year-old, and I'm not quite sure whether she was prompted by her parents or bribed into saying things, but she was fantastic. She talked about her favourite Great Britain, and she knew, and she dressed in the costume. So if we can inspire children at preschool about their history and identity, which we don't really, to be quite honest, because most educationists say, everything's all colourblind. It's only when you get to secondary school that you might start noticing stuff about your identity. No, that's rubbish. I can remember from a young age that you were told that you're the other. But how do we encourage and how do we empower, children at preschool, and then when they go into primary school and secondary school? Did anyone watch Steve McQueen's Small Acts, particularly the episode on education, where the whole issue on ECN, education normal? I was born in the 60s. I'm only 25, by the way. I was born in the 60s, and half my peers were classed as education subnormal because the education system at that time, we might think we might complain about it now, and there are some improvements, but trust me, in the 60s and 70s, it wasn't pleasant. It was overt, it was hostile, and particularly Black and Asian children were treated quite terribly. So I grew up in Wolverhampton, and because Enoch Powell, he was from Wolverhampton, the MP there. One of the consequences of his speech, Rivers of Blood, was that he didn't talk about immigration policy. That was the heart of his speech. But he also talked about education, and not many people were aware of that. He said that immigrant children would bring down the educational standards for white children. And that influenced a number of educational authorities and politicians, sadly Labour and Conservative, in terms of making sure that classrooms didn't have too many Black and Asian children in there. Almost like what happened in America in the Deep South in the 60s, around the whole civil rights movement. We had a similar situation here in the UK, where in places
you're making a really important point about history and how laws have influenced the current context that we have today, Patrick. I'm very conscious of the time.
Sorry about that. I got carried away.
Panelists.
Yeah,
I know.
Well, yes.
I know. I think the point that you made about all aspects of education is really important, from infant school, preschool, primary, secondary, and it's not just about Black History Month. We're in LGBT History Month, but we're doing an anti-racist event. So thank you so much. And talking about history and the importance of history, I think that's a perfect lead for Amy to join us and show us what she does at the London Metropolitan Archive.
Thanks, Lila. Yeah, no, I was listening, raptured there. So I'm Amy Taylor. I've been working in the heritage education sector for the past 10 years. I have a master's in heritage education, and as Lila said, I'm currently head of learning engagement at London Metropolitan Archives. And actually, one of our collections we have is Molly Hunt, and she was an educational psychologist who works a lot in that in the subnormal education field. So that's another link there. But I thought today I would just very quickly, with my 5 minutes, kind of introduce the London Metropolitan Archives for those that don't know it, and then I'm going to just highlight 2 projects that we've worked on recently, where we've been working to kind of foster a sense of belonging, and if you do want to know any more, then we've got a workshop this afternoon. So I'll just share my screen, do the magic. Hopefully you can all see that now. So I'll just start presenting. So also bigger for you guys. There you go. As I said, London Metropolitan Archives. So for those of you who don't know it, we're the principal archive for the City of London and Greater London area. We house a collection that dates back to 1067, and our first document is this tiny document you can see on the top of the PowerPoint slide. It's the William Charter. It's just 6 by 1.5 inches, and it was drawn up by William I and his coronation, and was given to the City of the people of London as a promise. Over that past 1,000 years, we've amassed a huge collection of books, maps, photos, documents, and videos which tell the story of London and Londoners. And here I really want to stress all London and Londoners. To give you an idea of how big the collection is, we always like to say if we stacked it from one end to the other, it would run from London to Brighton. So it's vast. The collections are really wide-ranging, and they cover aspects such as social care records, parish records, and business records, amongst many, many others. The physical collection is housed on site in Farringdon, for those of you who live in London, once we're, less pandemic-y, but you can also access the collection via our online catalogue and the London Picture Archive. So the first kind of project that I wanted to talk about is really digging down into our collections. This project actually is one that I worked on with my fellow panelist Veronica, and this project is called Switching the Lens, Rediscovering Londoners of African, Caribbean, Asian and Indigenous Heritage, 1561 to 1840. So back in 2000, there was a collaboration with the British Library to review Anglican parish registers, which were housed at London Metropolitan Archives, and over 2,600 individuals of African, Caribbean, Asian and Indigenous heritage were found in these records. Fast forward 20 years, and we've revisited this data with a contemporary eye, and working with collaborators such as Veronica and staff, we've been able to look at the way that this information is presented on our website, how you search for it, the functions and the terms that you use to search for this material, and basically kind of reveal these hidden histories that have been in our records for a really long time, and of course, acknowledge that these, people have been migrating to this country for hundreds of years, and those stories are there. It's just that they haven't always necessarily been able to be so seen because we've had a kind of white-centric view on history. So that's kind of from a historical perspective. From a more contemporary perspective, this is one of the projects that my colleagues worked on, and this was working with in partnership with Partnership for Young London. It was a contemporary collecting project called Know Your Roots, and we worked with young women, predominantly 14 to 18, thinking about representations of individuals of African and Caribbean heritage in the archive. So as you can see in the images here, we did some research through our archive and found some really sort of beautiful images that perhaps hadn't ever come to light, representing women in kind of all their finery, and just thinking about how historically people have been represented. As part of this, we then asked the young women who were part of the project to reflect predominantly on kind of appearance, so on kind of black hair and the way that women have been presented in terms of their appearance. And those recordings then were taken and have been accessioned into LMA. So again, that sense of belonging, having young women realise that they are represented in the archive and that actually they have something to say and contribute to the archive going forward. So that's my presentation. Thanks very much, Lila. I'll just stop sharing my screen. Lila, you're muted again.
Thank you very much. That's fascinating. Yes, two things. We need to look and celebrate and find more evidence of what happened in history and bust some myths. In the 1884, we had 150,000 Jewish people who came to the UK escaping the pogroms. Just before that, in the 1700s, there were 50,000 Huguenots who came, and the contribution of migrants, refugees, and people seeking asylum is phenomenal. 2019, 35,000 people applied for asylum and 51% got rejected. So the whole story about hostile environment, to say that these people are coming here to claim our job, is rubbish, and that doesn't even reflect what I think. Actually, I'm being quite tamed. So I think the work that you're doing, uncovering the legacy of our history, is phenomenal. Thank you very much. And you've got a workshop at 4 o'clock. So if people want to navigate the collection, they can come and see you. And talking about history and uncovering the past, we're now going to bring in Veronica Mackenzie, who's leading on many things, one of them being the Haringey Vanguard project. So Veronica, would you like to introduce yourself and spend a few minutes telling us about the Haringey Vanguard, which people can visit in the stall as well?
So thank you for inviting me to be a panelist. It's really good to be in an educational setting because it's not my natural domain. But so I'm the community engagement lead for the Haringey Vanguard project, and that's a BME LGBTQ+ history project. So the overall aim of the project was to collect the oral histories of about 40 activists who lived in the Haringey area, or kind of went out or socialised or had some connection to Haringey from the 70s to the 80s. So those are the years that we're looking at. And the items that we collected ranged from flyers to posters to minutes from Haringey Council meeting. We collected badges, from demonstrations. So it's a whole range of items that we've collected, and that's going to be deposited into an archive at Bruce Castle Museum, who are one of our partners. So the relationship that we have with London Metropolitan Archive is that they're our partner in this project. So they're overseeing the delivery of the project. I've been working on it for 2 years, and it comes to an end at the end of February. So we're in the middle of kind of planning an exhibition about the project. What I'm going to do is I'm just going to share a couple of slides with you, and I have a workshop later on. So let me share a couple of slides. Can everyone hear me, just to make sure? Let's have a look. Yeah, okay.
Yeah, we can hear you fine, Veronica. Thank you very much.
Okay.
Some people said they were experiencing problems with sound, and I want to apologize. Yeah. I think it might be linked to your own device or your Wi-Fi. I'm so sorry, but it is being recorded, and you will all have access to the recording. So yeah, Haringey Vanguard.
This is Haringey Vanguard. So the first question we need to always ask of me is, why do we need a BME LGBTQ project? Why don't we just have an LGBTQ project? And really, I'd been doing some research about 8 years ago in terms of growing up and going out and meeting other lesbians and going clubbing and everything else, my own coming out. I didn't see any of that represented anywhere. And I remember about 2013, trying to dig into some research and going online, and there was absolutely nothing online. I mean, this was, you can't say it was the early days of of Google, but literally only one site came up, and it was a guy who was doing his own blog, looking at history in the 80s, and there was nothing about the BME LGBT community. And I thought it was such a shame, because a lot had been done. And as I started to kind of like digging and talking to people, it kind of grew and grew into a bigger project. So people referred me to other people to speak to. So the idea came to represent a completion. So it's about trying to do a complete story of LGBT history, and to look at the bits that have been missed out. So it was about rectifying LGBT history, and making it complete. So that kind of grew into a bigger project, which led to a documentary called Under Your Nose. But still people were saying that, okay, we've seen the film, what about our history? What about all of the materials that we've collected? Where are we represented outside of the film? We're not in archives necessarily. There is one archive at LMA called the Ruckus Archive, but we're not really documented, we're not represented. So that led to the Haringey Vanguard project. So one of the things that immediately became apparent is that we know that history is written by the victors. So we know that anytime we look at history, we're looking at a retelling of history through the eyes of people who were successful. No one's going to write a story about the time they got beaten up or the time that they got vanquished or the time, do you know what I mean? These are not the histories that we see when we go into these institutions for most of the time. I did a talk yesterday about museums and how museums are dedicated to celebrating the triumph of a certain class, the triumph of certain countries, of a colonial project. That's what museums are about. And all of the stuff in them, the collecting, the categorization is a demonstration of power in terms of, the collections in the museum. So in terms of history, when you look at LGBTQ history, there wasn't really any acknowledgement of the Black queer community. There wasn't really any acknowledgement of what the BME community had done to kind of help progress the fight for LGBT rights. And it was quite shocking, really, because some of the key events and key happenings and key movements, BME LGBT people were directly involved. And I'll talk about that more in my workshop later on. But it is about kind of like just thinking LGBT history is very much represented from white gay men, and mostly middle-class white gay men. So when you think about gay history, you're really thinking about a particular type of history. So even when you think you're being alternative, you really are, do you know what I mean? You're still kind of constrained within what your knowledge base is. And a lot of the time it's not deliberate. This erasure of BME LGBTQ history is not deliberate. It's often an oversight. It's often because of various factors, which I'll go into later, the history has not been documented. So, like I said before, we collect footage, ephemera, flyers, posters. This is a poster of a very famous march which took place in Haringey 1987, Smash the Backlash, one of the biggest marches ever in Haringey. It brought union members, the BME LGBTQ community together, also people that lived on Broadwater Farm Association. So there is a real sense of community and, people uniting. So we were talking about the sense of belonging, and that march really epitomizes how, the kind of BME LGBTQ community and trade unions and community centres can work together. There's always a danger that we fall into in looking at them in very kind of separate ways. But many times over the struggle for LGBT rights, there has been a lot of coming together in community. Like I said, one of the aspects of the project is community engagement. So we've been gathering and sharing information, talking to local people, and also the other side of it is intergenerational exchange of knowledge. So like I said, it's a 2-year project. I can go into it in more detail in the workshop. It's a really rich, fabulous archive, and I'm looking forward to sharing it with you. So I'm going to...
Thank you very much. I think it'll be live at the end of February, won't it?
It will be, yes. It will be. So...
Yeah, I've stopped you from sharing because I need one more speaker. Yes, and people can come and visit your stall where you're giving a 45-minute presentation on the whole project. So they'll have you for an entire hour. Veronica, thank you so very much. It's fascinating. And I think it's very important to look at minorities within minorities when we're looking at minorities. Okay, so belonging, it's race, it's gender identity, it's disability, it's all the multiple identity, but we all have one thing in common: we all breathe. and I was really interested in mindfulness and compassion as being a way to kind of sort of like bring everyone together and build this kind of sort of like, we are the one, we are the future. So I'd like to bring in Alison, if you'd like to introduce yourself and tell us a little bit about mindfulness and compassion, and invite people to come and join you if they're interested in that a little bit more.
Thanks, Lila. Hi, everybody. It's really great to be here. My name is Alison Laycock, and I'm the founder of Being the Best You Can Be, which is, I teach mindfulness and compassion, amongst other things. So I was really impressed. I don't know if all of you caught the poem before from Andrea Leanne, and I thought it was absolutely wonderful. And there was a line that stood out to me, which was, take a breath into my lungs and breathe out. And I think, please correct me if I've got it wrong, but I think the name of the poem was Same Differences. And I thought it was wonderful. So I'm going to invite you all now to take that breath into your lungs. Sit quietly wherever you are and just notice that you're taking a breath. If you struggle with the breath, then just connect a hand maybe over your heart, just to feel that connection together. Just notice into the silence how you feel, how you are and who you are in this moment right now. You may feel a stronger connection with you, with your body, with your breath, and maybe a sense of belonging to you, and also to the rest of us sharing this event as we breathe together. Thank you. So you may have noticed there a few things. You may have noticed that you went calmer into that silence. You may have noticed a connection with yourself and that sense of belonging that people noted before, of being their authentic selves, being valued and finding comfort. And all those things you find within mindfulness. You can find them in other things as well. But mindfulness is one of those tools that we can use within the community and within education. And later in my workshop, I'm going to be doing other techniques, sharing practices. Happy to answer any specific questions you may have of how it could help you in your workplace or in your personal lives as well. Thank you. Thank you, Lila.
Fantastic. I think we started with stress management and we're ending with a tool to help us cope with the stress. That was absolutely phenomenal. I mean, I do practice meditation, so I was very keen to have you, Alison. I'm afraid we've run out of time, and I apologize because it's 4 o'clock and the workshops are about to kick in. So I've just invited back Luke, our sponsor, and also I want to thank Zoom, because without them, this event wouldn't have been possible. They've been phenomenally supportive of all the activities that I've done. And they recently given me quite a lot of licenses who have gone to communities who are really, really struggling. And I've just doubled the capacity of bereavement services in Haringey, Hackney, Islington through St. Joseph Hospice, and giving it to people who are really, really struggling. So there are some fantastic initiatives being done. So thank you, Zoom, and thank you, Luke and Cynthia from BAME Recruitment. So before we go into the workshops, I'd like to invite Luke to reflect on the last couple of hours. Hopefully that half a second mindfulness would have helped you gather your thought.
Thank you, Lila, and yeah, thank you, everyone. Gosh, what an amazing couple of hours. I felt very surprised and overwhelmed the last time that we did this with no expectations whatsoever. And I think this time again, how you bring so many people together with a vision and optimism, and that wonderful mix of the head and the heart is really quite something. So I feel very blessed and privileged to have been a part of this today. So thank you so much. I'm super conscious of the time, so I don't want to go over all of the amazing, wonderful, I suppose, reflections that I've taken, but maybe just to share a few, and not just the one which is I'm kind of slightly jealous that I have a couple of workshops to do, because I'd love to go and join Alison for some more mindfulness, because it's absolutely brilliant. But I suppose the big takeaways for me would be is I think, you know, the minorities within minorities piece, that intersectionality and that not labeling people, and the relationship that then has with trust and all of the things that come with trust, and how you need trust for good education and for proper health communication, and all of that feeding together to make someone's identity. I think that's the big reflection that I'll be taking away, and really thinking not just about in a professional context, you know, what that means, but also, you know, personally, how can we help others? How can we help those with mental health challenges? How can we help those, you know, outside of our own, you know, immediate social capital circles? And that will be certainly my reflection. So thank you.
And what are you going to do in your workshop?
My workshops, I've got two sessions. The first one will be any tips and advice employers might have on how to be a more inclusive employer. That's for the first 30 minutes, and I've got Eni and Miguel supporting me with that. And then secondly, we'll do 30 minutes on interview tips. You know, the whole world has moved to a virtual world pretty much, and I think those of us are fairly uncomfortable with interviews anyway, but how do you then do that when you're doing that remotely or on your phone? We'll be sharing some tips and thoughts around that.
Thank you so much. So this is the program, which I've put in the chat again, and you just click on the relevant Zoom link. So all of the workshops are either at 4 or 4:30, with the exception of Veronica's, who has got a more informal structure where she's got the entire hour dedicated to the Haringey Vanguard project. Thank you, Dr. Nafisa Graham-Brown. Thank you, Veronica, Patrick Vernon, Alison, and Amy. It's been an absolute honor to have you on board.